Hi, my name is Corina Cisneros. For my exam 1, I chose the discussion topics: discuss cardiac response to acute aerobic exercise, as well as discuss the effects of aerobic exercise on cardiovascular disease. For my first topic, cardiac response to acute aerobic exercise. An acute aerobic exercise are exercises that stimulate the brain because of the fact that both motors and cognitive process are being involved. There has been much research on whether aerobic exercise has positive or negative results. There's no specific way to define how acute cardiovascular response interacts with exercises, but because of the fact that there are different forms of outputs. One example of an output is cardiac output. This is the central determinant of the maximum oxygen that we consume. From rest to steady state, the cardiac output increases rapidly in the beginning and then plateaus. With the cardiovascular response, the heart rate increases with the increase in intensity of the exercise, which then causes the oxygen to increase during an acute bout, which goes hand in hand with the mass of exercise muscle metabolic efficiency, as well as exercise intensity. For the respiratory response, aerobic exercise is the greatest for both oxygen and carbon dioxide. The oxygen is then sent to the appropriate amounts of tissue, and carbon dioxide is sent to the lungs. Thanks to the ventilation, there is an appropriate amount of alveolar gas levels. Then this one-way acute cardiovascular response to the works in its atrial and left ventricle pressure and wall stress. This increase causes the mitochondrial metabolism to increase, which allows the blood flow through the coronary to increase as well. This increased parasympathetic tone then leads to decrease in resting and submaximal exercise heart rate, caused by the maximal cardiac output, an increase in stroke volume and fiber capillary densities. For my second discussion topic, I decided to discuss the effects of aerobic exercise on cardiovascular disease. Cardiovascular disease is one of the most common causes of morbidity in the world, accounting for 25% of deaths per year. This is probably due to the different factors, including high blood pressure, abnormal values for blood lipids, smoking, and obesity, according to Myers 2003. One factor that is not listed, however, and which is leading the list is the increase in sedentary lifestyle. Sedentary lifestyle is becoming inactive, not engaging in any form of exercise. This usually happens to those 60 years or older. Until recently, something has changed. According to European Society of Cardiology, there was a 54% decrease in cardiovascular deaths since the year 2018. This is because of an increase in physical activity, but not just any form of activity. Instead, aerobic exercise. Aerobic exercise is a form of cardiovascular conditioning because of the fact that these exercises improve lipid and lipoprotein levels. When aerobic exercise is implemented in your workout routine, your high-density lipoproteins, also known as good cholesterol, increases, whereas your low-density lipoproteins, also known as your bad cholesterol, decreases. This allows for your arteries to be clear, therefore allowing your blood to flow properly throughout the body, as well as reduce the amount of plaque and buildup in your veins.